and welcome to another Cafecito con NHCOA. Today's conversation focuses on a topic that is deeply important and often overlooked: mental health and aging. As we grow older, mental health challenges such as depression, social isolation, and anxiety can have a significant impact on our overall well being. Yet, these issues are too often misunderstood, underdiagnosed, or left unaddressed. Let's welcome our guest speaker for today's Cafecito con NHCOA, Dr. Luis Torres, a physician with over 30 years of experience in healthcare. Dr. Torres is a board-certified psychiatrist and neurologist, and has worked across a wide range of settings, including private practice, clinical research, and correctional healthcare. Dr. Torres currently serves as a neuropsychiatry medical engagement lead at Bristol Myers Squibb, where he continues to advocate health equity and clinical innovation. As Dr. Torres shares his expertise with us today, we encourage you to reflect on your own experiences in healthcare and think about how the information shared today can support you or those you care for. So, Dr. Torres, thank you for being here with us today.
In terms of mental health, the way that I think about it is there is no health without mental health. So there's two big components when we look at health in general, which is going to be physical health and then mental health. Some people define mental health as the absence of any behavioral health issues like depression, anxiety. So I view it as how well are we coping with our normal stressors. So we're going to have, days where the sun is out. We're going to have days where it's a bit cloudy, and then we're going to have days where it's stormy. So how are you coping with the days that are stormy? Do you navigate and at the end you're fine? Or do you struggle and then you spiral down into a bad cycle? Mental health is keeping that in check. And in terms of what are the most common behavioral health issues, especially in the senior population, the most common one is going to be depression. And, this will make sense as we get older. There's a lot of things that we lose control of. We might get a little bit more isolated, retirement. We might lose people close to us. So depression is the number one on the list, followed by anxiety and then cognitive issues, meaning memory problems. I just want to clarify, it's usually not a normal part of aging. We all have, good days and we all have bad days depending on what the day brings us. Some days, as we know, might be more stressful than others. It is normal to feel sad. It is normal to feel anxious. But what we need to watch is how long does that stay with us. So if you start feeling, sad and the sadness is not leaving for weeks or months, and in fact, the symptoms are getting worse, then that will be a warning sign where we might need to consider maybe seeing somebody. The normal symptoms to watch for example, for depression are going to be feeling sad most of the time, losing interest in activities that normally you like to do. Sometimes it also comes with changes of sleep, appetite, changes of concentration. And then if it comes to a point where we are starting to feel like we don't even want to be around anymore, feeling suicidal, then definitely that would be more of an emergent issue that you need to take care of. And then when we're looking into maybe cognitive functioning, when you should start getting concerned, if you start forgetting names on a regular basis, if you're driving and you're forgetting where you are or how to get to a place, or even simple things that remember ingredients or like how to carry forward a recipe when you're cooking. Those might be signs that you might need to explore more with a professional. Yeah, that's a very important question. And yes, we Latino are a community that we feel that we are very strong. So one of the common misperceptions is like if you look for help for mental health issues, that you're weak. So that's one of those taboos. Another one is like our community in general tends to be very religious. So like sometimes I feel like if I just pray, this might go away. And sometimes, there is a little bit of stigma still with mental health. Some of the Latino community might say like, oh, if I go and see somebody for my mental health, then they're going to feel that I'm loco. And that's a no-no for the Latino community. So how do we approach that as mental health professionals? I think it's important to really educate. It's also really important to get to a level of language that we can understand each other. Sometimes physicians have a tendency to speak, a higher language, and then the patients really get lost in translation. And especially with the Latino community, it is important to, have providers that actually speak the language and that understand the culture. Yeah, I'm glad that you're asking about loneliness, because loneliness is actually a big epidemic that we don't talk enough about. In the older group, there definitely loneliness can be a little bit more persistent, and there are situations in their life that can perpetuate loneliness. For example, retirement, losing, your partner, losing family members, getting maybe a little bit more isolated socially. And these are very important issues, because loneliness definitely can lead into depression. It can also deteriorate your physical health as well. What can we recommend people to do? Is really, the main issue is try to stay socially connected with meaningful relationships. Meaning having that friend that you can, talk anything with the friend or with your family member, taking care of yourself, going to social events, senior centers, staying active, like, playing golf or playing your favorite sport can get you connected with other people in the community. What we're really talking about here is social determinants of health. And these are very, very important issues, because they can really be a barrier to get access to care. So think about financial issues. If you cannot afford to see somebody, that is going to be a block for you to get treatment. If you have insurance, if you have transportation, and then simple things that we might not even think about. There is issues with food insecurity, and especially in the senior population. It's easier sometimes to go to a fast food place because it's going to be cheaper, or like you don't want to cook just for one person. And then really that translates into not eating the nutrients that you need for your brain to function properly. So like these are very, very important issues where like we do need to address, so like people have better access to a mental health provider, and even including like access to digital tools. So like a lot of these sessions now are done via telehealth. So like if the person don't have, a phone or a tablet to do those sessions, then that also interferes with their ability to get care. A lot of this might seem obvious, but I think that we are not intentional sometimes about this. When it comes to like cognitive functioning, I always recommend for the senior population to keep their brain active. How do you keep your brain active? Do puzzles, read books, engage in meaningful conversations with others. Besides that, I think it's very important to eat nutritional food. Also, it's very important to take care of your sleep. And then, as we were talking with the issue of loneliness, staying socially active and connected is also another area that the senior population can do to really have in check their mental health. If it's a family member, I think it's important just to be there for the patient and meet them where they are. So like trying to listen, I think listening is key, and trying to understand what are the fears that they have in terms of like trying to look for help, and then trying to provide them with the tools that they need to find those resources. If it is a mental health provider, I also feel that, again, it's important maybe to find somebody that speaks the same language and that understand the culture. It will have more effective results. So it's just about like understanding the stigma and reducing the stigma by educating, and then again, just meeting them where they are. Nowadays, I mean, there is a lot of like tools that people have access to get help, and it depends really in the spectrum, where are you in terms of your symptoms. So if you have like really very mild symptoms, there's digital tools now that you can just access and read and then practice some of like the recommendations that they have. You could even see a coach. But then if the symptoms are more persistent or impairing, then you might really consider seeing more of a therapist, which is a trained professional in mental health, or sometimes you might need to see a prescriber. So that might be a mental health nurse practitioner or a psychiatrist. There are instances where like maybe therapy might just work alone well, but sometimes if the symptoms are a little bit more severe or impairing, you might need to be on some type of medication to help with the symptoms.
As we finish today's Cafecito, we thank you all for joining us today to learn more about mental health and aging. We thank our guest speaker, Dr. Luis Torres, as well, for joining us today and providing our community and network with such helpful information, tips, and resources. For more information and assistance in finding mental health resources, the National Hispanic Council on Aging Resource Center is also available by phone call or WhatsApp at 202-658-8664. The NHCOA Resource Center is a multilingual hub that educates and empowers community members and constituents with accurate information and helpful resources. We invite you to share this edition of Cafecito con NHCOA with your family members, friends, and community. And don't forget to stay connected with us through our digital platforms and social media via @NHCOA. For more information about resources, updates, and future events. Until the next Cafecito con NHCOA. See you then.